Every single day, millions of older adults take medications they trust, never realizing that some of them may quietly affect memory, focus, and mental sharpness over time. And that is what makes this topic so dangerous. Because when memory starts slipping, most families assume the same thing. They assume it is age. They assume it is normal. They assume it is just part of getting older. But in some cases, it is not age at all. It is a pill bottle sitting in the bathroom cabinet. A prescription that was supposed to help. A medication no one ever thought to question, because a doctor prescribed it, a pharmacy filled it, and the label looked official. I'm Dr. Anthony Fauci, and after years of working with older adults, I have seen this pattern again and again. Someone who was mentally sharp their entire life begins to lose the thread.
Names. Appointments. Simple words.
The route home they have driven for years. And everyone around them says the same thing. Well, that happens when you get older. But sometimes, that is not what happened at all. Sometimes the real cause is medication. In today's video, I'm walking you through 9 medications and medication categories most often associated with memory problems in older adults. We are counting down from number 9 to number 1, and I want you to stay especially alert for number 3, because it is prescribed to millions of seniors for something that sounds completely harmless, yet it may be affecting memory and focus much more than people realize. Before we begin, tell me your age in the comments below, and if you feel comfortable, tell me how many medications you take every day. Now let's begin with number 9.
Number 9, diphenhydramine. Common brand, Benadryl.
Do not let the low position on this list fool you.
This one is everywhere.
Diphenhydramine, better known by many people as Benadryl, is one of the most common over-the-counter drugs older adults take for allergies, sleep, or nighttime cold relief.
It is cheap.
It is easy to find. And because it does not require a prescription, many people assume it must be gentle. But for the aging brain, that assumption can be dangerously wrong. Diphenhydramine belongs to a class of drugs called anticholinergics. That means it blocks a brain chemical called acetylcholine, which plays a major role in memory, attention, and learning. And that matters because as we age, the brain already has less reserve. So when a medication blocks one of the very chemicals the brain depends on to form memories, the effect can hit older adults much harder than younger people. People often take it thinking it is just helping them sleep. But over time, it may also be increasing brain fog, mental slowing, and forgetfulness. Here is what to do. If you use a nighttime sleep aid, a PM medication, or an allergy pill, read the label carefully. Many of them contain diphenhydramine even when the front of the box highlights something else. And if allergies are the issue, ask your doctor whether a newer antihistamine may be a safer option for long-term use. Never stop a medication casually on your own. But do stop assuming that over-the-counter means harmless for memory. Number 8. Proton pump inhibitors. Examples: omeprazole, esomeprazole. Next are the medications many people take for heartburn and reflux. These are the proton pump inhibitors, often called PPIs. Drugs like
Omeprazole,
esomeprazole. They reduce stomach acid very effectively, which is why so many people stay on them for years. But the problem is this. Your stomach acid is not there by accident. It helps break down food and helps your body absorb important nutrients, including vitamin B12, magnesium, and other compounds that help support healthy nerve and brain function. When stomach acid stays suppressed for too long, those nutrient levels can gradually fall. And when older adults become low in things like B12, the symptoms can look a lot like early cognitive decline.
confusion,
Forgetfulness.
mental slowing, poor concentration.
That is what makes this category so sneaky. Sometimes the issue is not the brain deteriorating on its own. Sometimes the medication is interfering with what the brain needs to function properly. If you take a PPI every single day, ask your doctor whether it is still truly necessary, whether the dose is still appropriate, and whether there are safer step-down options. For some people, lifestyle changes, shorter-term use, or alternative stomach strategies may reduce the need for long-term exposure.
Number 7, oxybutynin.
Used for overactive bladder. This one is prescribed for a problem many people feel embarrassed even discussing.
Oxybutynin.
It is commonly used for overactive bladder and sudden urinary urgency. And to be fair, for many seniors, bladder urgency can feel life-limiting. So when a medication offers relief, it is understandable that people take it. But oxybutynin is another drug with strong anticholinergic effects. That means it also interferes with acetylcholine, the same memory-related brain chemical we just talked about. And unfortunately, oxybutynin is especially concerning because it can affect the brain quite strongly in older adults. That means a person may feel like their bladder is improving while their thinking quietly becomes less clear.
They may notice more forgetfulness, more difficulty concentrating, more word-finding trouble, more mental fog.
And because it happens gradually, it often gets blamed on aging instead of the medication. If you or someone you love takes oxybutynin and memory has noticeably declined over time, that is worth discussing with a doctor. There may be alternative treatment options that do not place the same burden on cognition. And that brings us to number 6.
Number 6. Certain statins.
Examples: simvastatin, atorvastatin. Now this one needs balance, because statins help many people and can be very important for heart and stroke prevention. So this is not a blanket attack on statins. But it is an honest conversation about side effects some people experience. Statins lower cholesterol. And while that can be beneficial for cardiovascular health, cholesterol also plays important roles in the body, including within the nervous system. Some older adults report memory changes, mental slowing, or brain fog after starting certain statins, especially higher dose statins or those more likely to affect the central nervous system. Not every statin affects every person the same way.
Some people do beautifully on them.
Others notice a very real change in clarity.
The key point is this.
If you started a statin and then notice changes in memory, focus, or mental sharpness, do not ignore that pattern. Do not stop the medication on your own. But do bring it up with your doctor. Sometimes a dose adjustment, a switch to a different statin, or a careful review of risks and benefits can make a big difference. The goal is not to protect one part of the body while silently harming another. The goal is the right treatment for the right person.
Number 5. Benzodiazepines.
Examples: Xanax, Ativan, Valium. Now we come to a category that has helped many people in moments of anxiety, panic, or insomnia, but can become extremely problematic with long-term use. These are the benzodiazepines. Examples include
alprazolam, lorazepam, diazepam.
These drugs calm the brain quickly, which is why people often feel strong relief at first.
Sleep improves.
Anxiety softens. The nervous system quiets down. But over time, the downsides can become serious. These medications can cause
sedation,
slowed thinking,
poor concentration, falls, dependence, withdrawal problems,
worsening cognitive performance. In older adults, the brain is more sensitive to these effects, and long-term use can create a pattern where people feel less sharp, less steady, and less mentally resilient. And the hardest part is this. Once someone has been on them for a while, stopping suddenly can be dangerous. So if you take one of these medications, do not quit abruptly. Instead, talk with your doctor about whether it is still necessary, whether the dose is appropriate, and whether a slow taper or a different treatment plan makes sense. This is one of the biggest medication traps older adults fall into, not because they did anything wrong, but because the medication helped early and the long-term cost was never fully explained.
Number 4. Amitriptyline.
Older antidepressant, also used for pain and sleep. This medication is prescribed for more than many people realize.
Amitriptyline may be used for depression, nerve pain, sleep issues,
migraine prevention. And that wide range of uses is exactly why so many older adults end up taking it. But it is also one of the stronger anticholinergic drugs still commonly used. So once again, we are back to the same problem: blocking acetylcholine, interfering with memory, and increasing mental fog. What makes amitriptyline especially tricky is that many people are not taking it for mood at all. They are taking it for pain or sleep. So when memory problems begin, they do not think the medication could possibly be involved.
But it can be.
Even relatively modest doses, taken over long periods, may contribute to slower thinking, forgetfulness,
reduced attention,
poorer short-term memory. If amitriptyline is in your medicine cabinet, it is worth reviewing with your doctor, especially if the original reason for taking it is no longer severe, or if better tolerated alternatives may exist. Now let's move to number 3.
Number 3, paroxetine. Common brand, Paxil.
This is the one I told you to watch for. Paroxetine is an antidepressant often grouped with SSRIs, and because SSRIs are generally seen as more modern and safer than older antidepressants, many people assume they are all basically the same.
They are not.
Paroxetine stands out because unlike many other SSRIs, it has stronger anticholinergic activity. That means it can affect the same memory pathway we have been talking about throughout this video. So while it may be prescribed for depression or anxiety, in some older adults it may also contribute to short-term memory decline,
word-finding difficulty, attention problems,
more noticeable mental dullness over time. That makes it especially concerning in seniors, because the very medication meant to help emotional well-being may, in some cases, come at a cognitive cost. This is one reason many geriatric specialists are cautious with paroxetine in older adults. If you take it, do not panic. Do not stop it suddenly. But do ask an important question. Is this still the best option for me? In many cases, other antidepressants may be better suited for older adults with fewer cognitive concerns. Number 2. Antipsychotic medications. Examples: quetiapine, risperidone, olanzapine. This category worries me deeply, because many older adults taking these medications never expected to be on an antipsychotic at all. Drugs like
Quetiapine, risperidone, olanzapine
were developed for serious psychiatric conditions. But in real life, older adults are often given them for
agitation, sleep, restlessness,
behavioral changes, or simply because caregiving has become difficult. And that is where things become dangerous. These medications can heavily sedate the brain and may increase the risk of worsening cognitive decline,
falls, stroke,
severe sluggishness,
emotional flattening.
Families sometimes describe the person as still being there physically, but somehow less present mentally. That should never be taken lightly. Now, there are situations where these medications may be necessary, but they should never be treated like harmless calming pills. If you or a loved one is taking one, ask directly. Why was this started? Is it still necessary? What is the current goal? Is there a plan to reduce it if possible? Sometimes the real issue is pain, poor sleep, overstimulation, or an untreated medical problem, not something that truly requires long-term antipsychotic exposure.
And now we come to number 1.
Number 1. Anticholinergic burden from multiple medications. This, in my view, is the most overlooked danger of all. Because the biggest problem is often not one single drug. It is the combined burden of several drugs taken together.
A person may be taking
one medication for sleep, another for allergies, another for bladder control, another for pain, another for mood, and each one may have a mild anticholinergic effect. Individually, maybe it seems small, but together, they can create a serious cumulative assault on memory, focus, and brain function. That is what makes this so dangerous. No single doctor may have looked at the full list all at once. No one may have calculated the total anticholinergic burden. And the patient may have no idea several of these medications affect the exact same brain chemical. This is where many cases of medication-related memory decline may begin. The good news is that when medication-related cognitive issues are caught early, improvement is often possible. That is why this video matters. Because once the burden is recognized, a doctor or pharmacist may be able to reduce unnecessary medications, substitute safer alternatives, simplify the regimen, and remove avoidable strain from the brain. If you take multiple medications, especially if you have noticed worsening brain fog or forgetfulness, ask for a full medication review. Not just a refill.
Not just a quick follow-up.
A real review. That one conversation may be more important for your brain than almost anything else you do this month. Closing. So now I want to hear from you. Of the 9 categories we talked about today, which ones are currently in your medicine cabinet? And have you noticed more brain fog, forgetfulness, or confusion since starting a new medication? Tell me in the comments below. And if this video helped you, subscribe to the channel, turn on the notification bell, and share this with someone you love, because too many families are calling memory loss normal aging, when the real cause may be sitting in a prescription bottle. This is Dr. Anthony Fauci. Stay sharp, stay informed, and I'll see you in the next video. Medical disclaimer. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Never start, stop, or change any medication without talking to your healthcare provider.